We're just giving a couple of minutes for people to join so that we can start in a few minutes. We'll be starting in a couple of minutes. We are waiting for the participants who have registered to join us. Good evening, everyone. Welcome to Southern New Hampshire Cancer Public Information Meeting. My name is Dr. Sai Sharmala. I'm the Bureau Chief for the Population Health in the Division of Public Health Services in the Department of Health and Human Services. And today you'll be hearing a presentation by Ms. Whitney Hammond, our Cancer Program Administrator. Ms. Hammond will be sharing some background information, current data, and next steps for the department's response to community concerns about cancer. We want to thank all town managers who helped us to promote this meeting and helped to schedule it at a time that would cause least conflict with other community events. I want to acknowledge and thank all of the people who are taking their time this evening to listen to our presentations, to those who have reached out to us already, and to the people who have submitted questions in advance. I want to take this moment to address some of the questions. We have been talking with the individuals from Southern New Hampshire since early December to understand what the questions they have, to learn about their own experiences with cancer and other health issues. I want to take a minute to reflect on the seriousness of this issue and share that we have been hearing from folks around the clock because they're concerned and want to understand what's going on. People have been contacting us wanting to know what they can do to help and to prevent others from going through the cancer, what they are going through. I'm overwhelmed with the wisdom and insight and of all the people who have called us. People understand about their cancer and very much want to understand what might have caused it, but also realize that this is not going to be possible. People have shared their understanding that there are a range of risk factors that can be associated with different types of cancers, and that it is unlikely that we would be able to determine a specific cause for their cancers. We have learned how challenging it is to have a cancer and an environmental exposure intertwined. We are working to help support people as they navigate this through. We want to thank our Department of Environmental Services for being our partner in working to respond to multiple dimensions, multiple scopes of this work involved in this situation. I know we had the opportunity to talk with a number of people who have been impacted by kidney cancer or have loved one be diagnosed. We hope that you'll continue to be willing and be able to work with us as we move forward towards next steps. So coming to the logistics for today's meeting, I want to make people aware that this meeting is being recorded in order for us to be able to post it on YouTube for others to access who may not be able to attend today's evening meeting. This meeting is being hosted on Zoom, which includes both our web-based option to join and a phone number for people to dial in. Additionally, we are also thankful to some of the towns who were able to broadcast this meeting on their local television. In an effort to be very inclusive as possible, we are going to offer a few different options for submitting your questions. There is a Q&A function for online participants. There is a phone number as well that will be featured at the bottom of each slide. If you're watching from home, viewers can call 603-271-4959 to ask any question at any time during the webinar. If you're calling into the webinar, we'll give you instructions when we get to the Q&A section of the agenda. We also would like to invite anyone to contact us after the meeting if you would prefer, and contact information will be shared at the end of the presentation. I know many of you have sent in questions and have other questions about like your water and the status of other agencies' work in your community. We have provided that information at the end of the presentation with more detail on who can respond to the questions that might go beyond the scope of this meeting or our investigation. Lastly, we are always looking to improve our work in the community meetings as we serve the public. Please do consider taking time to complete our evaluation that will be shared at the end of the meeting and also will be sent out via email to people who registered for the meeting. Thank you all once again. And at this point of time, I'm turning this to Ms. Hammond for the presentation.
Hello, thank you, Dr. Sharala, for that introduction. And I would just add in, I'm seeing people are using the chat function and the Q&A function. And so if you're having difficulty or you have questions about how to submit a question or you're not hearing the audio, I encourage you to just reach out and ask. So my name is Whitney Hammond, and I'm the administrator for the cancer programs at the Department of Health and Human Services, and that's in the Division of Public Health Services. And I'm going to talk us through more detail about what the department is doing related to cancer in Southern New Hampshire. So I've sort of framed my slides around just questions, and really a lot of that was based off of, I feel like that in the last month and a half or so, we've been getting a lot of questions, and that's really been what has helped to guide my thinking about what people might be interested in hearing in today's meeting. So what is this meeting about? I'm going to do my best to provide some background on the department's response to concerns about cancer in Southern New Hampshire. I'm going to describe our process for community response and really help people to understand what we've done and where we might be headed. One of the biggest things I want to do, and I think this is really important for people, is to clarify what we can and cannot do. I think there are a number of things that we wish we would be able to do and questions that we wish we could answer, and those aren't going to be feasible given the protocol that I'm going to go over. But I want to make that clear for people so they understand. I will share some of the preliminary findings that have been shared previously in December of this past year. But I just want to walk people through those and try and simplify it as best as I can. and then prepare people for what's next. And this is really key for this meeting. If nothing else, I want people to feel like they understand what they can do and how they can be helpful. And then most importantly, my goal for tonight is to just hear people's questions and concerns. And based off of the questions and concerns that we've received as part of the registration for the meeting, I anticipate that there are going to be a number of things that people are looking for answers to, that I might be just kind of explaining the difference between what our department can do and what other agencies can do and answer. And so hopefully, at the very least, people leave with a little more of a lead on where to go with questions. So how did this start? When I think about this, and this even predates my involvement in this response, really the start of all of this was in 2016 when polyfluoroalkyl substances, or PFAS, were found in the drinking water in the Merrimack Valley District Water System, or MVD. As I understand it, that led to a number of questions from people. And I sort of tried to capture in this dialogue bubble some of the things that I have heard that people had as questions when that was discovered in 2016. So people were wondering, have I actually been exposed to PFAS? I know from talking to people, sometimes it's not even clear if you're on public water or if you have a private well. People were wondering, am I at risk for PFAS exposure? And then, okay, so what will PFAS exposure mean for my health? What's being done to protect me, and what can I do to protect myself, and really just what's going on. So that was kind of a lot of what was bubbling up in response to learning about the PFAS detection in the MVD water system in 2016. So who has been involved? So I wanted to just kind of capture this to highlight that while the Department of Health and Human Services is presenting this evening on our cancer response in the community, there have been a whole number of different state and federal agencies, as well as other partners, who have been involved in kind of shaping the response since 2016. So there's been the New Hampshire Department of Health and Human Services, and I'll go through a little more detail of how we've been involved since 2016. We also have our partner agency, the New Hampshire Department of Environmental Services, that's been involved in lots of things related to water and PFAS and just environmental exposures. There's the Center for Disease Control and Prevention, or CDC's Agency for Toxic Substances and Disease Registries, or as we refer to them, ATSDR. And I'll be sharing a little more information about how they've been involved, and also just providing information on a community meeting that they'll be holding on the 2nd of February. So that's a federal agency that's been involved. And then there have certainly been community members that have been involved, whether as advocates or just kind of reaching out to us and expressing their concerns, as well as policymakers or legislators who have established study commissions to try and dig into this issue and understand more of what's going on. And then researchers in academia. So there's been a lot of work to understand PFAS and what the health impacts are. And a lot of that work is really done with our academic partners. I did this little doodle of the arrows and lines that are all overlapping in different colors, because I sometimes feel like, even as someone who's involved in this response, it can be a little bit confusing and feel like there's overlap, and it's not always clear, which entity or agency is involved in what way in response. And so I just wanted to sort of capture that and reflect back that that's what we oftentimes hear when people call us. And I just want to make a mention of, and I will throughout this presentation, don't let that be a barrier to reaching out. So if you call us, if you call the number at the bottom of the slide, if you use the email address that we're going to share later, it's okay if we're not the agency that can answer your question, because we're working really hard to be coordinated. And so if I know of somebody at the Department of Environmental Services who can answer a question, I'll do my best to link you with them. So what has DHHS done? This is a timeline. It starts back in February of 2016, and that's when PFAS was found in the MVD water supply. I was not involved with this, but to the best of my understanding, around October of 2016, the department engaged in what we call our MVD exposure assessment. And that was offering blood testing to individuals who wanted to see what PFAS levels were in their blood. That was done for a number of months. At the same time, we had received a request to look at our cancer data and to see if there was anything that we could see using that data that would indicate anything going on in the community related to cancer. So in January of 2018, the department published our cancer report. I did a call out box just to sort of summarize for people who may not be familiar with that report. It is publicly available on our website. You could Google and find it, or again, just contact us and we'll be happy to connect you with the link. The findings in that report were that there were no cancers associated with PFOA that were found to be higher than would be expected in the Merrimack community. That report included sort of recommendations and next steps that the department had related to the findings. And those included a plan to look at data in the next 1 to 2 years to just understand, if anything changed with additional cancer data. In June of 2019, there was a legislative commission established on PFAS in Southern New Hampshire. The department has a representative on that commission who provides updates on what the department's doing and who also provides us with updates and information about what that commission is interested in. That commission, starting, I think, around early 2020, started to ask the department about our plans to update the cancer report. There were a couple of things that sort of all came together to delay our being able to do any kind of updated analysis until very recently. One of those is related to the way that we get our cancer data in New Hampshire. So the way that we gather all this information about anybody who's diagnosed with cancer that lives in New Hampshire is through the hospitals that do the diagnosis and treatment of individuals. There are very specialized individuals that are employed at each of those hospitals, and they're called certified tumor registrars. And those individuals are actually going into the electronic health record, gathering data, and then they ultimately submit that data to the state's cancer registry. The state's cancer registry is operated by Dartmouth, and we have individuals there who do a lot of processing of the data, making sure that it's high quality, that it's complete, all of that stuff. During 2020, during the pandemic, and while hospitals were being impacted by that, there were impacts on those certified tumor registrars. So some of those individuals were temporarily furloughed, and that did impact our ability to have timely data. We also had a vacancy beginning at the very start of 2020, and our cancer epidemiologist, who is sort of ultimately the individual that looks at our cancer data, that position became vacant and has remained vacant and still is at this point in time. In an effort to still be able to respond to people's concerns and requests for updated data, we did work to use our chronic disease epidemiologist and to have him do the analysis of cancer data to help us to look at what was going on. And so in December of 2021, the department did provide an update on cancer analysis to the 737 Commission, which is the Commission on PFAS in Southern New Hampshire. We shared our findings and then shared with that commission that we would plan to host a virtual community meeting, which is what we're doing today. So does DHHS have a plan? The answer is yes. So New Hampshire DHHS has a protocol that we follow. We follow this for any kind of inquiries that we get from individuals about concerns they have regarding cancer in their communities. It's a publicly available protocol. I've included a link that people can use if they would like to go and read through it. And I will let people know that New Hampshire's protocol is largely driven by the protocol from the Centers for Disease Control and Prevention. They have produced the current guidelines. They were effective starting in 2013. They're currently in the process of revising those guidelines and anticipate a release of updated guidelines this year, so 2022. I did include a screenshot from our cancer concern investigation protocol, and I put a red box around just some key information that I wanted to highlight from it. So the CDC, and then similarly, the Department of Health and Human Services, looks at a number of different criteria when we think about responding to community concerns related to cancer. So we look at the observed number of cases of cancer and whether it's higher than we would typically see in a comparison population. I'll talk more about how we do that in future slides. We also look at whether concerns that we're receiving relate to cases that involve the same type of cancer or different types of cancer. And again, I'll go into a little more detail about why that's important. We also look at the population that people are saying that they're seeing cancers in. So, sometimes we even receive concerns about an entire county. And that can be a really big geography when you're thinking about some kind of an environmental exposure. We look at whether the boundaries for the area are carefully defined and based on some kind of perceived exposure. So I would say almost half the time when we get a call, an individual is just calling because they're seeing different people that are getting cancer and they don't necessarily know of anything in the environment that they are thinking is connected to those cancers. And then the last thing we look at is really the time period for cases occurring. And I'll talk a little bit about how we think through the difference between, when somebody's diagnosed with cancer and how long it might have been between when they're diagnosed and when they may have been exposed to something, which factors in for cancer. So what's the plan? I've included this flowchart to just kind of walk people through the process that we go through at the department. And I have a red circle to kind of indicate and draw people's attention to where we're at right now in our Merrimack community response. So there are 4 phases. Phase 1 is when we receive concerns from what I am referring to as a reporter. I use that term really broadly. We invite anybody to contact us who has a concern. So we hear from community members, we hear from family members of people who have been diagnosed with cancer. We do sometimes hear from legislators or community advocates. And so we receive those typically by email or by phone. Again, we're including that contact information in our slides. We work to try and be quick in responding to those concerns. So we aim for about a 2-day turnaround time to at least, call the people back and hear a little more about what's going on. The goal of that is for us to make a decision about whether there's something that we should look into further, or probably for around 95% of calls that we get, we just provide a little more education around those different features that we look for in a potential cancer cluster. So again, those things about, are there multiple types of cancer that people are reporting? Something that I think people may not be aware of is what I think of as one of the biggest risk factors for cancer is age. And so a lot of times we actually get calls from people, and I've gone through this myself, people who have lived in a town for quite a while. They may have lived in the same house for quite a while. And all of a sudden, after 20, 30 years of living there, it feels like they're seeing a lot of their neighbors who have lived there that long be diagnosed with breast cancer, colon cancer, lung cancer, all these different cancers. And so a lot of the way that we respond to those concerns is just through providing some education about that age is a risk factor for cancer, and then talking about how every different cancer has different known risk factors. And so a lot of those cancers that I just listed don't necessarily have common risk factors. If it sounds like there might be something to the concern, we move on to phase 2. So we've decided we should do some further investigation. Phase 2 is when the department conducts a review using that database that I described earlier. So the New Hampshire State Cancer Registry data. We use that data to be able to look at things like the number of people that have been diagnosed with a particular cancer, We can look at trends in cancer over time to see if things are increasing. We can look at, is a particular type of cancer occurring in men more than women? So there are certain things we can do, and we, try and use that data to help us think through our next steps. We also, as part of phase 2, convene what we call our Cancer Concern Review Team, or CCRT. That group, I'll go into more detail about who's included in that, but it's really focused on bringing together partners from within the Department of Health and Human Services who have expertise in things like environmental epidemiology, cancer prevention, as well as bringing in people from other agencies. So we have a number of members on that team from the Department of Environmental Services, and then we also have partners from Dartmouth. So people who are working in the State Cancer Registry, and also people working in the Cancer Center there. The goal of the CCRT convening and looking at the cancer registry data is to, again, make a decision about should further investigation occur. Should this go to phase 3? So in the case of Merrimack, back in 2018, when we did our first look at the cancer registry data and looked at cancers, we looked at all sorts of different types of cancer and did some analysis, and ultimately concluded at that time that there should not be further investigation because we weren't seeing any kind of signals indicating that any particular type of cancer was higher than would be expected. So we sort of looped back to that first box in phase 2 and kind of started this process again in 2021. In 2021, when we did our analysis, we did find that kidney cancers were higher than would be expected. And I'll go into more of the detail on that number on a future slide. But for now, I just wanted to emphasize that that led us to go to phase 3. So phase 3 is, again, we use that group of individuals in our Cancer Concern Review Team, and really tap into their expertise to try and determine if any kind of a study would be feasible to do. And there are a lot of things that go into that decision-making process. And I've kind of called them out in this box off to the right side. So we look at trying to determine whether it's plausible that cases and contaminants could actually be associated. One of the major limitations with the New Hampshire State Cancer Registry is that the only information we get about where somebody lived or lives is based off of their address at the time that they were diagnosed. And so, as many of you know, you may have lived in the same place your entire life, but there's also a good possibility that you haven't. And you may have lived in one town your whole life, but at a different house, or you may have lived all over the place. And so to be able to determine plausibility of cases being connected with contaminants, we oftentimes want to gather more information, and we want to look at things like somebody's residential history over their lifespan, and maybe look at things like where they've worked as well, so that we just get a better picture of where they spend their time. Another part of what we do at this phase is identify available data on environmental contaminants. So in the case of Merrimack, again, a lot of this started back in 2016 when people were very concerned about PFAS being detected in water. But we also do know from our partnership with the Department of Environmental Services that we should be thinking about if there are other environmental contaminants, whether that's because they've been identified in the area, or also if the literature shows a connection between them and particular types of cancer. Another part of what we're doing is just identifying a study design and what the requirements are, and if there are available resources to conduct a study. So, I'm sure people can imagine that there are costs associated with conducting a study. You need the expertise of someone to design the study and carry it out. So we're in the process of sort of thinking that through. You also have to identify the parameters of a study. And one of the biggest things that we're focusing on now, and I do want to answer questions about tonight, is what we refer to as our case definition. And that's really thinking through and trying to make the best decision about how specific to be with how we define a case. And that means, how granular do you want to get in terms of thinking about how you define the geography of somebody? And I know we received a lot of questions from folks that don't live in Merrimack, but might live in a neighboring town like Litchfield or Londonderry or Bedford. And so they've asked, are we likely to be involved? Is that geography being considered in this? And that's absolutely part of what we think through when we think through our case definition. And you really want to be careful to be, as inclusive as you need to be, so that you're, going to have good numbers and you're going to be able to identify anybody impacted, but at the same time, sort of specific enough that you don't sort of water down the results of what you're looking at. So there's a lot of work involved in the case definition. Also talking through how you might identify people to be controls. So people that don't have a cancer diagnosis that you might be able to compare to your cases. And then just the feasibility of obtaining data from study participants. And I talk about that a little more for number 6. Oftentimes, I think when you hear the numbers, when I in my future slide, when I talk about that there were 66 cases or people who were diagnosed with kidney cancer in Merrimack, it's difficult to understand why that wouldn't mean that 66 people would be willing to give us all the information about their residential history. And I always just like to draw people's attention to that each of those 66 cases is a person who might be going through cancer treatment actively. They might be going through other things in life that are going to make it so that now is not a good time for them to be participating. And so we do a lot of work to try and understand if that's the case and how many people might be willing to participate, because it won't likely be all 66. So a lot of our work is exploring the willingness of people to participate in a study. And I do want to just take a second to acknowledge, we have received a lot of calls from individuals who live in the community and have been diagnosed with cancers and have expressed a willingness to participate. And that's a huge help to us. So I encourage anybody who thinks you might be somebody that would be touched by this, reach out, let us know if you're interested. We will keep your information and include you in our future steps. So we're at phase 3 and we're really figuring out, is a study feasible? And if we decided that, yes, a study is feasible, we would go on to phase 4. I put in here that DPHS conducts a study, but it's really DPHS figuring out a partnership with an academic facility to potentially do further study. And I'll talk a little bit about the nuts and bolts of what that could entail. But for people, for right now, it's good to know we're in phase 3 and we're kind of where that red circle is in terms of study, is a study feasible? So what is a standardized incidence ratio? I really kind of am going to try to balance I don't want to get too technical, but I don't want to, be so kind of high level that there's not enough information for everyone. So standardized incidence ratio is really what's recommended by the CDC as the way that we look at cancer in a community. We calculate it to give us an estimate of the likelihood that there's an excess of cases in a certain population of concern. And I underlined estimate because in a future slide, I'll talk about kind of the nuance of it being an estimate, and that there is a little bit of a window of where, when you make an estimate, you sort of have what you think the potential lowest estimate is and highest estimate. And I'll get into that in a future slide. Since cancer rates vary by age, which I talked about earlier, age is definitely a risk factor for cancer. The SIR is a really good tool for us because it looks at age-specific rates. So it makes it so that if you're looking at a town where people just happen to be a lot older than the rest of the state, it helps to actually be able to compare that town with an older population to the rest of the state that might not have that older population and account for age. The SIR is the recommended measure for comparison of cancer in small areas. So if anybody's ever taken the time, and if you haven't, I encourage you to do it. Look at the department's website. We have a data portal, and you can actually look at a lot of different cancer data at a county level or at a state level. And you'll see in those situations, we don't use a standardized incidence ratio. We really just look at age-adjusted incidence rates. And that's because we're looking at larger groups of people, and it's a little bit easier to compare. But in the case when you're looking as small as a town with maybe 4,000 people, this SIR is really the recommended way to compare things. And as I was trying to think through, for people that, don't necessarily know the details around the statistics with this SIR, I wanted to give them an example of something comparable. And the best thing I could come up with was, if you've got a car, you're probably familiar with all those little lights that can light up on your dashboard. My husband finally explained this to me after I called him a number of times and said, this one's lit up. The genie lamp is lit up. What do I do? So you've got the difference between the red indicators that really tell you, stop now, and this is exactly what's wrong. So you've got your battery, you've got your oil. The SIR is not like that. It's more like your check engine light. So the check engine light tells you, like it's a signal, like something could be going on. You probably want to, bring this to the garage. But it doesn't tell you what's wrong. You still need to do a lot of additional diagnostics and gathering information before you can really understand what that signal means. And for me, I think of the SIR as that check engine light. So hopefully that helps to kind of clarify where we're at in terms of really understanding what's going on. So what have we found? So this is the more detail around the numbers. So we analyzed back in 2018, we analyzed 27 different cancer types in Merrimack. And if you think back to when I was talking about the protocol that we have and that the CDC has recommended, that's not really what they recommend doing. When somebody has a concern around cancer, typically the guidance is that you try and focus in on, a particular cancer. And if it's a particular environmental exposure, then you maybe look at cancers that the science has shown are related to that environmental exposure. But in 2018, to be as responsive as possible, and because the science was still really emerging around PFAS, the department went ahead and looked at all 27 different cancer types. So those included, and again, you can look online at our report and you can see the detail by cancer type, but all those different, breast, colon, prostate, all those different cancers. And so that went above and beyond what the science has really shown is associated with PFAS, which would just be kidney cancer, testicular cancer, and pancreatic cancer that have some evidence of an association between PFAS. To be consistent with that initial report from 2018, we went ahead and ran those numbers again. So we looked at all 27 different cancer types, despite the fact that, again, we knew that there was only evidence around those 3 types of cancer in PFAS. So we ran all the numbers, and we did find a higher number of people with what we call kidney and renal cancers in Merrimack. What did that boil down to in terms of actual numbers? So the number of people that we saw who were diagnosed with kidney cancer in Merrimack was 66. That was compared with what we would expect to see based off of looking at rates in the rest of New Hampshire. We'd expect to see 47 cases. And that was for a pretty good chunk of time. So we ran the numbers looking from 2009 to 2018. I am happy to give more information about the cancer registry and the limitations in terms of how recent we can look at data. My quick answer is 2018 is the most current data that we have. We have information from beyond that, but it's not considered complete. And so we're not generally encouraged to be looking at incomplete data. So we did, in addition to looking at the numbers and seeing that there was a higher than expected number of cases, we did testing to look at whether that number of cases is what we call statistically significant. And I underlined the word statistically because I have received feedback over the years in this position that a lot of times people hear the word significant and they'll hear, oh, that number was not significant, or it was statistically significant. And that can sound like we're saying that, you know, an individual's cancer is not significant. And that's not what this means at all. And so I even just put in there, you know, every single case is significant and every single case is noteworthy. In the case of statistical significance, that was really looking at, given that it's an estimate, you know, does the estimate that we're looking at fall into a range that would make it above what you would expect to see. And so for anybody that has taken statistics, I just threw in that good old bell curve image in the bottom, which just might be a little bit of a reminder for people about what we're talking about when we say, you know, we're confident that the estimate is somewhere between this amount and this amount. But really for most people, the takeaway here is we did the testing and it really verified that, yes, there's a statistically significant excess of kidney cases in Merrimack. So what does this mean? So, and I kind of pulled these together. Myself and one of my colleagues at the department have been responding for the last 6 weeks or so to calls from people. And I wanted to just sort of summarize some of the big ones that we've gotten and give an answer to them. So does it mean that there's something in Merrimack that's causing kidney and renal cancers? So does that significant excess of cases mean that? We don't know. As I said, we don't even know until we collect more information if individuals that were diagnosed with kidney cancer while living in Merrimack had actually been living there, you know, for more than a week before they were diagnosed. That's probably not the case, and it isn't for 66 people. But again, until we get more information, we just really don't know. Does it mean that PFAS is causing people in Merrimack to get kidney cancers? Again, we don't know. We do know from the scientific literature that there has been an association found between PFAS and kidney cancer, but we also know that there have been a number of other risk factors identified for kidney cancer. And I know from having talked with individuals that have called us that have been diagnosed, that a lot of them have talked to their doctors and are familiar with a number of different, you know, known risk factors. There are some other environmental exposures that have been found to be connected with kidney cancer. And then there are some of those more typical things people are familiar with, things like, you know, smoking or, you know, other lifestyle things. So right now, we don't know that the finding means that there's a connection. Does it mean that DHHS is going to look into other kidney-related health issues? So again, I think this is a really frustrating thing to have to explain to people, and I wish that it wasn't the case. But my answer to that is we don't have data for this. So the department there's actually a law that has established the state cancer registry, and that law gives the department the actual statutory authority to be looking at data and to be carrying out this investigation. And we just don't have something comparable for other health-related issues. A lot of what I work on at the health department involves things like diabetes, heart disease, oral health. And none of those have something comparable to that state cancer registry. So it's not that they're not really important things. And it's not that, you know, PFAS, which is really driving the concern here, isn't shown to be associated with other health issues. It's just that the department is working within, you know, what it is we actually have for data and what we have statutory authority to do. Another really common question we have received is, does it mean that there's a connection between cancer and Saint-Gobain? And again, I just have to emphasize at this point in time, we just don't know. And it's very possible that even if we go through all of the phases that I outlined in our protocol, and we get to that phase 4 and we do a case control study, it's not necessarily going to be possible to determine a particular source or entity that is connected to PFAS in a water system that a person may have been exposed to. So again, just we don't know at this point in time. And I know for a lot of people that still doesn't change, you know, your belief about a connection. So who is involved? I just wanted to give people a little more of a sense of who's in that cancer concern review team for the department. I'm here presenting today, but I am not the expert on a lot of these different topics. I'm really the facilitator, the person who pulls together all those different experts and tries to work through that protocol that we have. And so we have people that participate on that who have a lot of knowledge around cancer epidemiology. That's really how do you look at the numbers, what's important, what are the questions we want to ask and answer with our data. We have people with expertise in environmental epidemiology who understand things about, you know, how do you map people with cancer? What do you want to look at in terms of geography? We have a lot of expertise, both from our department and the Department of Environmental Services, around what's called risk communication, or just trying to translate all of this complicated stuff in a way that makes sense for people. And then we have experts on the guidelines for cancer cluster investigations, and then even people who are familiar with the geographic area and environmental concerns of the community. As we move along, we may look to add people. We know how important and valuable it can be to actually have members of the community be participating in our decision making, and individuals who have been impacted by the cancers we're investigating. So what happens next? So the next part of what we're doing is considering the possibility that cases and contaminants could be associated. So a lot of that's going to involve trying to gather information about where people have actually lived, worked, to kind of add to that data that we have in the New Hampshire State Cancer Registry. We're actively working to understand people's ability and willingness to participate in giving us that information. We'll be determining study questions and design. So we are working really closely with Dartmouth and researchers there to understand, you know, what do they think would be feasible in terms of a study and getting a study that could be funded. So we're working with them. Depending on what they come up with, we may need to look to identify a different lead organization. And then another part of what we're doing right now is really digging into, could there be funding available to do this type of a study? So in New Hampshire, the department, as I said, we have the sort of legislative authority to be doing this type of investigation, but we don't actually have much in terms of resources to actually operationalize that final step in the protocol, that phase 4 case control study. That's something we really need to leverage partnerships to do. So what about other towns? We have looked at cancer data for more than just Merrimack. We've included, and we looked at these individually. So we looked at cancer, those 27 different cancer sites for Merrimack. We did the same type of calculation for Litchfield, Bedford, and Londonderry. And in all of those towns, we didn't get that signal around any of the PFAS associated cancers. So again, if you think about my analogy of the car and the dashboard, we didn't get the check engine light in those communities. That doesn't mean that we won't do everything we can to try and consider those additional towns being included in that case definition that I talked about. And I think there can be some real benefits to broadening our case definition to include those communities. It can give us a larger sample size. So you could go from having those 66 possible people to having more that might be willing and able to participate. And we absolutely know that in those communities, there are a number of people who have concerns about PFAS exposure, may have learned about having PFAS in their water. And so we're going to do everything we can to be inclusive of individuals from those communities as well, even though we didn't have any of our cancer analyses give us that signal that something, that there were a higher than expected number of cancer cases in those communities. What could we find? So really at the end of that entire protocol, if we get to phase 4, the most that we can find is if an exposure is associated with an outcome. So I just kind of gave this high level overview of a case control study. So you're basically looking at your geography or the population that you are interested in looking at, an association with an outcome. And then you start to look at, okay, people who are diagnosed with kidney cancer versus people who also live in that area that haven't been diagnosed. And then you would start to compare exposure between people who have that cancer and those who do not. And so I drew the yellow arrows to just sort of pull out and emphasize that really what you'd be comparing in a case control study would be, was the exposure different between people who are considered cases or have a certain cancer and those who do not. And so that's really what's going to be feasible with a case control study. What can't we find? So we've had questions about a lot of these things, and I just want to kind of set realistic expectations for people about what we won't be able to find with the department's investigation. So we're not able to find a cause of an individual's cancer. That's just not the nature of a case control study. And I know that's not satisfying. I know everybody really wants to understand if some particular thing caused their cancer or their family member's cancer, but that's not what the department's able to do. We won't be able to find that there's a specific cause of an environmental exposure to a chemical contaminant. So again, we'll look at exposure and the differences between people who have a cancer and don't, and level of exposure. But it's really not the Department of Health and Human Services that does the sort of tracking back from an exposure to what was the source of it. We won't be able to find a connection between PFAS exposure and some sort of new health outcome that's not identified in the scientific literature. That's really not the role of the department. There are other agencies and certainly people in academic institutions that are very much focused on this and answering the question of what are health outcomes associated with PFAS exposure. And so we'll be, keeping an eye on what it is that they're doing and finding, but it's not going to be the department that's able to make that kind of a connection. And then I included this image. This is my own dog, Cece. I just included her picture because I can't emphasize enough how many people have reached out to us and expressed concern about their pets. They may have pets that have been diagnosed with a cancer, pets that have a tumor, and they're really wondering if there's something in the environment that's causing that. And as much as I wish we had data on pets, that's again, just something the department doesn't have access to. And so we're not able to do any kind of additional investigation. So another big question that I get from people, and I think this is one of the most important things for people to take away from this evening, is what can you do? Because it might feel like there's not a lot based on what I've said, but there is. So I'm trained as a social worker. One of my favorite little tricks is when you've got a to-do list, you always start it with something you can check off right away. So I wanted to just sort of start by saying you're already doing something by being here tonight. I know it's not probably people's, first choice to be spending time listening to me and learning about this, and but really, educating yourself and getting more information is a huge first step. Another thing you can do, and I know a lot of you have done, is share information about our investigation with other people. I think my colleague got a phone call from somebody the other day who's living in England, had lived in Merrimack, and somebody who's still living in Merrimack that's a friend of theirs had reached out and said, hey, you should know this is going on. And those are the exact kind of community connections that we just don't have at the department. We don't have some kind of a way to know who's lived in Merrimack and moved away. And that's really the value that you all bring. So please just share our contact information, share what you've learned. This presentation is going to be recorded and is going to be on YouTube. And I'd encourage people to share it, post it, that adds a lot of value. reach out to us and let us know if you think you might be a case. Really, we want to hear from you. We'll take time, we'll listen. And even if it isn't the case that you would meet that criteria, we could learn a lot from you. So again, reach out, don't hesitate. You can just email us. If you prefer to call us, you can even write us a letter. And then participating in next steps of our investigation. I know for everybody that's not going to be possible, but if it is, the more people that are able to participate, the better our sample size and the more we might be able to understand. Participate in other community meetings from other agencies. If you think back to that, crazy image of all those arrows and the sort of, mess of all these agencies trying to help and respond to community concerns, I know there are a lot of meetings. So I know just next week on the 2nd at 6:30 p.m., there'll be another meeting where the ATSDR is going to be presenting their report on the health impact study that they've done. And again, if you participate in that and learn about that, that's another thing that you can do. We did receive a lot of questions from people about different cancer screenings and what's recommended. And I am happy to respond to those as best I can and to kind of connect you with different, web-based resources that'll highlight the different recommendations around cancer screenings. But talking to your doctor is also a really good idea if you're concerned about your health. They're going to know for you individually, given your age, given your family history, what is recommended. And then really just don't be shy. Contact us. We're pretty much responding within the day to emails and phone calls. That number is mine. I will answer the phone and I'm happy to talk with you and just hear what your questions are or any concerns that you have. And we're trying, maybe people have heard this term. I think we're doing a good job with this. We have a really strong partnership with the Department of Environmental Services. It's sort of a no wrong number or email approach. So if you contact me and I think, gosh, this isn't something I can answer, this is a question about the public water system and understanding what's known about testing for public water, I'm going to do my best to connect you with the person at the Department of Environmental Services who can give you that answer. So just call us. Don't worry about getting the right person. So what should you remember? These are the takeaways, because I know I went over a lot today. This is a signal. It's like that check engine light. It's not the red one. We don't know what it means, but it's a signal to look closer at kidney cancer. And that's what we're working to do. Probably no surprise for people. Government isn't known for moving quickly. It will take time. It's going to take time to gather information from people who have or have had kidney cancer. It's going to take time to bring together all those different experts and really figure out, what's the best way to collect information. So, again, be patient. We will do our best to cast a wide net. We have heard from so many people in towns neighboring Merrimack that they're equally as concerned and they want to know what's being done for them. And so we're absolutely aware of that. And as we can, we'll work to do a good job of being inclusive in terms of those next steps around gathering information from people with kidney cancer. This is probably not a surprise to people, but we may not be able to answer all the questions that you have. It may be that it's just something that's not the Department of Health and Human Services role, or it might just be that, science really hasn't answered the question. But I do want people to know we're committed to doing everything possible that we can do, and that we're here to answer questions and connect with you and connect you to other people who can answer your questions. So I believe at this point, I wanted to draw people's attention to the bottom of this slide. We have a phone number available because we know that some towns are broadcasting this on local television stations. And so for people that are participating in the meeting that way, if you have questions that you want answered, because we're going to just enter into a Q&A session, just go ahead and call that number and we have somebody, Andy, who's answering the phone and will relay your question to us. We also have the Q&A box, which I can see we've got maybe around 27 questions in. And then I'm going to take time, though, first to go through a list of questions that we received as part of the registration for this meeting. I do want to first say before I switch, I'm going to switch from sharing my slides, and I think Victoria is going to put up a slide for when I'm answering questions. But I do want to say, if you submitted questions and they're outside the scope of what the department is focused on, hopefully you've heard back from somebody at our department about who would make sense to connect with at a different agency. Let me just put this up for people. Now that I'm looking at this, the font is a little bit small. I believe the slides are going to be sent out as follow-up to this meeting, so people should be able to look and kind of see more closely the different contact information. I put myself in the yellow box here, so that's my name, my contact information. And then folks at the Department of Environmental Services were kind enough to share with me the different sort of types of questions that people might have related to PFAS in the area, and all the different people they have available to answer questions. So you'll see there's somebody listed for general questions about just in general PFAS and funding. There's a toxicologist who can answer questions about health and exposure. There are people who can talk specifically about site investigations, drinking water, and even air-related issues. So some of the questions that we received, actually a lot of them, almost half, were related to things like PFAS, water testing, if there's funding available to help people with testing water, installing treatment systems. All of those things are really more in the Department of Environmental Services, agency. So I'm not going to go through that whole list because my answer would just be talk to this agency. But I am going to go through the questions that relate to our investigation. So Victoria, I'm going to stop sharing my slide. There we go. And all right, so there's our phone number. And then I am going to just take 1 second and pull up the list of questions that we've received ahead of time. All right, so the first question is, what data brought up this concern about cancer in Merrimack? So I think actually my response to a lot of these questions is going to reference back to the presentation I did, but I did want to take time to just go through people's questions because they took the time to submit them, and I want to make sure people feel like they're answered. So the data that brought up this concern about cancer in Merrimack was really largely related to people learning in 2016 about PFAS detection in the MVD water supply. And that really led to concerns about a whole number of health issues, including cancer. And that led the department to do that first report in 2018 and then do the subsequent report in 2021. What really pushed us to do the updated report in 2021 was that 737 legislative commission that's been convened to look at PFAS and health in Southern New Hampshire. And that group really saying, when can we get an update on cancer data? The next question I have is, has the total number of renal cancer cases risen from the initial count of 66 from 2009 to 2018 due to increased public awareness? So I would say the answer to that's a little bit complicated. As I mentioned before, we've actually heard from a few people that have said, my friend called me, they let me know that this is going on, and I thought you should know. I've lived in Merrimack for a long time. I then moved from Merrimack, and, a year later I was diagnosed with kidney cancer. So I just wanted to let you know, because I'm guessing I'm not, counted in your study. So we have learned of a few people that probably, lived in the area, but weren't diagnosed when they lived in the area. And we're keeping track of that. And I would invite people, if that describes you, reach out, give us a call, send us an email, because that's something we don't know using our state cancer registry data. That said, if you think back to that analogy of the check engine light, we already have our signal. So we're not really looking at sort of recalculating that standardized incidence ratio because we already have a signal that's significant, that's kind of telling us we should do our next steps. So that's sort of the two-part answer. We're not changing that number of 66, but it's very important that people reach out to us if they think that they should be counted. The next question is, what types of cancer are associated with PFOAs? So the way that I'm going to answer that is largely based off of the scientific literature, and really particularly looking at cancers that have a found association beyond just one study. So the three cancers that we've really referenced as being related to PFOAs are kidney cancer, testicular cancer, and pancreatic cancer. Next question is well water and bladder cancer. This is what I have. So in response to that, bladder cancer is not one of the cancers that was found to be higher than expected in Merrimack. There has been some research into well water and bladder cancer, in particular in northern New England, which is Vermont, New Hampshire, and Maine, and looking at the connection between arsenic, which is another environmental exposure that can occur and is much more common in northern New England than in the rest of the country. So there's been research looking at arsenic in drinking water and bladder cancer, and that research has shown an association between the two. The next question is, I'm curious as to why other cancers have not been added to the list. For example, colon cancer. I became very ill. So in terms of the list, I think of two different lists. One list is the list of cancers that we included in our cancer analysis. I didn't include it in my slide deck, but you can see the cancers that were looked at in two different places. So we have our 2018 report that's available on our website, and that'll list the 27 different cancer sites that we looked at, and that does include colon cancer. The other list that might be referenced here is the list of cancers that are associated with PFOA. And again, I would just sort of go back to the way that we're defining PFOA associated cancers relates to the scientific literature and what's been found so far. And so it doesn't mean that in the future, there might be enough kind of research and evidence to show a connection. But for the department's response, we're really letting the scientific literature lead our sort of list of defined cancers associated with PFOA. The next question is, I want to know more about kidney cancer. I would be happy to connect with anybody who is interested in getting more information about kidney cancer. We have a number of really good resources that we use, whether it's the American Cancer Society's website. The Centers for Disease Control and Prevention have some really nice web resources that would provide information about kidney cancer and what are the known risk factors for kidney cancer. And then I would absolutely recommend that you also talk to your doctor, get more information from them about their understanding about what's recommended around kidney cancer and, what you should be potentially thinking about. The next question we received was breast cancer concerns and death. I'm going to guess that that's somebody saying that they are concerned about breast cancer rates in the community. And I would, again, kind of refer people back to the 2018 report. And then our data from 2021 is available as well on our department's website. And in both those instances, we did look at breast cancer. And we didn't find a signal that there were a higher than expected number of breast cancers in that community. The next question we received is there medical data about the local incidence of cancer? Is there evidence of the link to St. Gobain's? So part one, yes. We're really fortunate. As I said before, cancer is one of the few things that in the state of New Hampshire, we have excellent data around the incidence of cancer. So the New Hampshire State Cancer Registry has been operated through Dartmouth for decades now at this point. And Dartmouth the folks there could tell you all the different kinds of awards and certificates they've received over the years from the CDC around their data quality, the completeness, the timeliness. So we really do have a state-of-the-art cancer registry in New Hampshire that enables us to look at data. The second part of that question is there evidence of the link to Saint-Gobain? And I would say, at this point, no, and there may not be the ability to even make that kind of a link, even when we've completed our investigation. Next question is, does this have anything to do with the town's water problems? So yes, the investigation itself was started based on 2016 and finding levels of PFAS detected in the MVD water. So that's what really led to the investigation. And that's definitely something that we're keeping in mind as we continue to develop our approach around gathering data. That residential history will give us a lot of information about whether people are on private wells, whether they're on the public water system. And then we even do have data about PFAS levels in the water based on a lot of the work that our partner agency, the Department of Environmental Services, has collected. The next question is, are the high rates of cancer due to Saint-Gobain poisoning our groundwater by illegally dumping toxic chemicals? So I think I've answered this at this point. So there aren't high rates of cancer overall. It's a higher than expected number of kidney cancers found in Merrimack. And at this point, we don't have any ability to link that with any particular organization or any particular environmental contaminants. So for now, the answer is no. The next question is, has a survey been completed to assess cancer rates in Londonderry? So there's sort of two pieces to that. The first is none of our data is done through survey, which I think is actually really nice. There's no burden on people to alert us when they're diagnosed with cancer. That's something that the law has been established and enables us to gather that data from those different hospitals that are diagnosing and treating people. And so we have that data, and we have looked at that data and done the analysis for Londonderry, as well as I said, Litchfield and Bedford as well. And we just haven't found a similar signal there. Have you investigated cancer clusters in Litchfield? I know of 5 cases in my neighborhood, myself included. So investigated, I think, is a little bit strong. We have done the analysis looking at cancer data for those 27 different cancer types in Litchfield, and we haven't seen any significantly higher number of cases than would be expected. The second part, I know of 5 cases in my neighborhood, myself included. That's a situation where I would absolutely encourage you to reach out to us, let us know. That's really valuable information for us to hear, and we would invite you to do that. The next question is, can we get screened for cancer to make sure? And does Saint-Gobain cover the costs? Thank you. So a little bit of a nuanced question. You can get screened for cancer for a number of different cancers. If memory serves, recommendations, and these vary for individuals. So it depends on your age, it depends on your gender, and it really depends on your personal preferences too. So I would largely encourage you to talk to your provider about cancer screening, talk to them about your concerns, and ask them what's recommended. I've shared on the slides my go-to resource. I use this personally before I go to the doctor, is the United States Preventive Service Task Force, or USPSTF. That's the kind of non-biased guiding body that looks at different clinical procedures and makes a determination about whether they're recommended. People are probably familiar with the cancer screenings that have pretty strong evidence and are recommended, and those include breast cancer, cervical cancer, colorectal cancer, and lung cancer, and in some cases, prostate. But again, that's not going to be for every person, every age. So you really want to talk to your doctor. In terms of kidney cancer, there is no recommended screening at this point in time. So you could talk to your provider if that's something that you're concerned about and want to know about early signs and symptoms. And then the second part of that question was, does Saint-Gobain, or would Saint-Gobain cover those costs? No, that's not something that is established. All of those cancer screenings should be covered if you have health insurance because they're considered essential health benefits. So use that phone number on your insurance card, call them, confirm, but they should be included if you're eligible. Lung cancer screening has pretty specific criteria for who's eligible. And if you don't have health insurance, but you're really concerned and you're interested in getting screened for cancer, our department, and actually this is within my section, so I oversee the program. We do operate a free screening program for breast and cervical cancer screening for certain individuals who meet the criteria. So if you're interested in that, please use the phone number or email that we provided and we can get you connected. And we have screening sites all across the state. Is it next question is it recommended that people who grew up here be tested, especially if they have thyroid issues? And are there any studies on kids? So I'll break that into pieces. So is it recommended that people who grew up here be tested? No, there's nothing from what we found that would lead to any kind of difference in clinical recommendations for cancer screening, especially if you have thyroid issues. Nope, that shouldn't alter the clinical recommendations. But again, I would talk to your provider and see what they recommend. And then if there are any studies on children. So I'm not the person that has the pleasure of reviewing all the scientific literature around PFAS and health impacts. I did include contact information for the Department of Environmental Services toxicologist. He is the person I would recommend connecting with if you're interested in getting more detail about, what studies have been included, what populations have been included in different studies, what health outcomes have been studied, and he can probably connect you with some other good resources and reports. The next question is, what is recommended for screenings to catch any cancer in the early stages? Again, I think I covered this in the earlier question. I highly recommend the USPSTF and talk to your provider. The next question is, what can you tell us about access to mental health services for cancer patients and their families in these towns? I can tell you that those large hospitals that we call cancer centers that diagnose a lot of people with cancer and are providing treatment for them, they also oftentimes do have people on staff, whether that's social workers or people who are running support groups. Those are great places to start. And you can even reach back out to if you have a provider that treated you for cancer and now you've been discharged and you're really kind of struggling. I would recommend calling back that treatment provider. They can be really helpful connecting you with support groups or even helping to make recommendations to individual mental health providers that might be helpful. Okay. Next question is there a lawyer who is handling a class suit? Merrimack has let this go way too long. My answer for that is I don't know anything about that, but I would encourage you to reach out to your representatives. Those are probably individuals who would be aware of something of that nature. Next question is, there have been 2 kidney cancers diagnosed in my house, 1 death. Are we contemplating legal action? So my first response is, I'm really sorry to hear about that. It's a lot, and I can see how 2 kidney cancer diagnoses in one house is really concerning. In terms of, are you contemplating legal action? Again, that's not something that I would be able to answer, but I'd encourage you to reach out and talk to others in the community who might be involved in that kind of a thing. And I would encourage you, if you're willing and able, to reach out to us and just let us know, tell us your story, give us a little bit of background, because that's really valuable to us. And then the last question that we received in advance was statistical comparison of groups with and without cancers discussed in study, specifically R-squared relationships and means testing. So I think this is actually somebody who's a little bit ahead of the game, and they're talking about wanting to see the sort of statistics and all that methodology that would be involved in our the fourth phase of our response to community concerns. So they're really talking about that study design that I had the different blue boxes highlighting, and talking about that really the next step to understand, is there something is there an environmental exposure that is, different in people that have kidney cancer? Really what we would do is look to compare people with kidney cancer to those that don't have kidney cancer, and try and understand if there's a difference in exposure between those two groups. So right now we don't have that, but that's absolutely what we would be working towards in the future if we determine it's feasible. So that's it for questions I received in advance. And then I will turn to, is it Martha that's going to be running additional questions by me?
Hello, good job answering all those questions. And some of them that are coming in are a little bit redundant. They've been asked before. So, and we do have quite a process for fielding the rest of the questions. Because we have the public participating in this meeting from several different ways on different devices, we're going to take questions in sections. And so for those of you who are watching right now on your local station, I want to just emphasize that you can call in, and that's the number that you've seen on the screen. That's the 603-271-4959 number. And Andy will answer your call, and then we will present those questions to Whitney. So the process that we're going to use tonight is, first, we'll address the questions that have been submitted in advance, and you've just heard those. And then next, we'll take the questions from those who are on the phone on this webinar. And so then we'll address questions from those who have called in while watching. And then last, the questions from those that have been circulating in the Q&A on this webinar. And you can continue to type those questions. All right, so we've covered the submitted questions. And so now we're going to take questions from the callers. So you were able to join this webinar by calling in, and there are several of you who have done that. So to maintain your privacy, we're going to call on you using the last 4 digits of your number. And so to do this, we need you to hit *9 to let the moderator know that you have a question. It's kind of like raising your hand. You'll let Victoria know that you have a question, and then she can give you access. So to speak, you'll need to hit *6, and then you will be muted automatically. So for those who are on the phone, we'll just pause for a moment. If you want to ask a question, hit *9. And Victoria will call on you, and you'll be able to ask your question.
I apologize if you hear snoring in the background. It's my dog.
And we're just going to give it a minute so that we can tee those up. She's indicating there are 3 questions, but the first person that was teed up to go just had some connection problems. Oh, and now there are no raised hands. So I'm assuming now there are no questions from people who are on the phone and joining this webinar. So next, we're going to take the questions from people who have been watching this webinar. They're not registered for it, but they're watching it on their local TV on the local station, because they were gracious enough to broadcast this. So to do that, again, I just want to reinforce that you can call the 603-271-4959 number, and Andy's answering your calls. And so we're going to let Andy join now and ask the questions that have come in that way that he's collected.
I'm actually on a call right now. So,
Okay, we'll let you finish it up and then you can join us.
okay.
Good to hear questions came in that way.
Would it make sense to answer any of the ones in the Q&A?
Sure, yeah, I'll jump to that page.
Okay.
So some of them, I think that you've gotten to, but I just want to reinforce them. What are the causes of PFAS being in the water?
So that's one where I would refer people to one of our partners at the Department of Environmental Services. So I have their contact information in the slide deck. And actually, I'm not even sure that they would necessarily be able to answer the question about cause, so much as being able to at least answer questions about, has it been detected? What's the level it's been detected at? But again, for the Department of Health and Human Services, that's not something that we're able to answer.
Kind of related along the waters, are PFAS in the municipal water supply, well water, or both? And has this shifted over time was a question.
I would refer that to the Department of Environmental Services. They would be the ones who know the difference between public water system and private wells and, how things have shifted over time.
And have the levels diminished over time of the PFAS?
Same answer in terms of referring people to the Department of Environmental Services.
So why do you think there's a difference between SIR numbers between 2018 and 2021 assessments for renal cancer in Merrimack?
So just as a point of clarification, we ran the numbers in 2021, but the data was actually through 2018 that we ran in 2021. But the person's correct that there was a difference. And that could be for any number of reasons. But if you were thinking about the amount of time, so with cancer, there's this thing, and I was trying to think of a good analogy when I was preparing for tonight. And I was thinking about poison ivy, because I'm always trying to explain to my two girls not to play in poison ivy. And they're always like, well, it's fine, I didn't get poison ivy. But there's actually that what we call latency period between when you're exposed and then when a rash shows up from poison ivy. And cancer is like, it's similar in terms of having a latency period, but the period between exposure and actually having cancer as an outcome can be much longer. And so if there was something that you're being exposed to over time, it could in theory be that the longer you kind of look at the health impact, the further you go out, you might see that health effect from an exposure. Not that I can say that that's why, but that could be one of the reasons that we see the signal now when we look at data as opposed to earlier.
So more questions about the water. Should we not drink our water in Litchfield? Specifically, PFAS has been detected in Amherst on Buckhill Ridge Road and Woodland Drive. Will studies look at this?
To answer the question about whether your water is safe to drink, I would definitely refer you to the Department of Environmental Services, because I think there are a couple of different things that factor in, and that would be, what is your water source? Do you have a private well? If you have a private well, have you tested the water? And if you tested the water, what was the level that was detected? And if it was detected at a certain level, did you install some kind of treatment system? And then did you retest, and what's the level now? And then if it's public water, I think there's a whole nother set of questions that would need to be answered before somebody would be able to say whether it's safe to drink the water. And then the second part of that question was about, will this be studied? And I would say, again, in our effort to cast a wide net in terms of thinking about that case definition, I think Litchfield is absolutely being considered as one of the areas to include in the case definition when we think about geography. So, in theory, we would be including people from that community that also had kidney cancer.
So another question about the concentration of PFAS in water and wanting to know if people are ingesting it, if you have high levels in your well water.
So again, I think that would be a question of, so if people want to know about the levels in their well water, there's testing available. And again, the Department of Environmental Services would be good at answering, how do you do that? And if there are any resources available to help with that. And then the second part was about if people are drinking it.
Are they ingesting it? Mhm.
So again, I think that's sort of on an individual household basis of, you know, what is the level in your well? What have you done to treat it? And then what are you drinking it?
So the next one related to testing of cancer, could tissue samples be some sort of proof? Will the doctor recommend urine cytology tests each year to look for cancer? And then also, are blood tests available and where can I receive one?
So in terms of tissue sample, part of what we're having conversations with our academic partners at Dartmouth around in terms of that, you know, part of determining if a study is feasible is looking at, you know, what kind of information has already been gathered from folks. So if you think back to the timeline that I shared and the MVD exposure assessment where we did blood testing, we're doing a little bit of digging into whether or not those samples would be something that would be available to do additional testing on, or if the results of those samples could be useful in some sort of a way to add to the data that we'd be capturing. So that could be something, and that's the sort of thing that researchers in academia, you know, that's sort of the gold standard, and they would like to see the ability to do that kind of additional information gathering to look at things like exposure. Because again, I think the earlier questions about water and water consumption and levels of PFAS in water get to that, like, you know, you can measure what's in water, but then it's also probably important to measure what's in somebody's actual, you know, body in terms of what they've ingested. So that could definitely be a part of a next step.
So this person's asking, of the 66 cases, is that data only from 2018? So can someone diagnosed with kidney cancer after that date participate in future steps? So if you're one of those cases, should you expect to hear from someone?
I'm really glad that somebody asked that because I meant to address it. So to answer the first part, the 66 cases are people that were diagnosed from 2009 to 2018. So if you've been diagnosed from, let's say, 2019 to, you know, today, you're not included in that count of 66 people. That said, we might have your data available to us in the New Hampshire State Cancer Registry because, as I had said before, we get data, it's just not considered complete until 2 years after. And so as we start to try and outreach people and identify people who have kidney cancer that might meet the case definition, we'll likely use our cancer registry and try and use that address that we have from when somebody was diagnosed. But it's absolutely helpful to us if you think you might be a case to just go ahead and reach out, whether it's by phone or email, and let us know, because that's how we can sometimes capture people that have been diagnosed after 2018, or people that, again, may have been diagnosed after, you know, moving from the area, but had lived there previously.
So the next question, will you move beyond data by town and define the DES area of known contamination as the area of potential impact and do a data analysis of the known area of exposure?
Not as a part of this investigation. So we're really going to be honing in on the geography that we have and we're able to define using the cancer registry data, and just trying to understand more about the residential history of those cases. Down the road, if there were to be some kind of, you know, if we were to go into phase 4 and we were to look at a case control study and we had found something from capturing that residential history, we might use that to kind of think about a geography and compare things. But we won't per se be using, I think people reference the geography of the consent decree.
So another question about the study, will another PFAS exposure blood test study be done for private well owners and Merrimack Village District customers?
To the best of my knowledge, that's not something that's planned. However, I can, if people have that particular question and want to reach out, I will follow up and ask other people at the Department of Health and Human Services. That's outside the cancer program. It was a different program that helped to do that previously. And again, I have not heard that that's the case, but I don't want to say that as an absolute.
And then another question was, person was curious, are urologists and oncologists showing an interest in sharing data to understand Merrimack increased rates of cancer, kidney cancer with Dartmouth?
Yes, and those are all the different types of providers that are actually required by the state to report to the New Hampshire State Cancer Registry. So we do receive information about people who are diagnosed by urologists, and even then, we've been starting to reach out to those types of individuals to get their input during that convening of the Cancer Concern Review Team, that CCRT. So we're using that kind of expertise as well.
So about the cancer registry, will you maintain a cancer registry of all exposed residents for the next 100 years, the lifespan of children who were exposed?
So the cancer registry is, as I said before, legislatively established. It's been around since 1985. I hope that it would continue. There's no indication that it won't continue. That said, we are very reliant on federal funding from the Centers for Disease Control. We're one of the states funded for what's called the National Program for Cancer Registries. And if that funding were to go away, you know, I'm not sure that we would be able to maintain the registry. But again, it has been around since 1985. And as far as I know, you know, will continue to be supported. And so, yes, we would be capturing cancer data for all residents of New Hampshire.
So regarding funding, this person wants to know, is St. Gobain funding any of your work?
No, St. Gobain does not fund our work. We're funded entirely by our CDC grant funding for the National Program of Cancer Registries. And then we do get a small amount of state general funds to support us.
What confidence do you have that you'll know when you get caught up on the data? How long will it take to catch up past 2018?
I'm very confident. As I said before, we have had our contract with Dartmouth for a few decades now for the New Hampshire State Cancer Registry, and we partner with the CDC, who conducts a lot of data quality assessments, and we have a long track record of having very complete and timely data. I think our operations are really back from the pandemic and from that point in time when the certified tumor registrars were furloughed. So I'm fairly confident that we'll have good quality data. That said, it does continue to be the standard that we don't consider data to be complete until 2 years out. And that's just a function of how the reporting works and the data quality checks.
The next question, it's kind of a two-part, actually it's two questions. Will someone test the genomics of each affected kidney case in the 66 cases seen so far to see if there are similarities? And then will you present and share the genomics of the cancers found in the exposed?
So that would definitely be a part of what might be considered in the phase 4 or the study process. So really partnering with those academic researchers who might be able to look at the genomics and testing. And then that data would absolutely be, you know, in a sort of aggregated way so that their confidentiality is protected. But the results of that would be shared through, you know, some form of publication.
There were several people who shared personal stories in the Q&A. And they want to know what they can do to prevent exposure to this harmful substance. And then if you can reiterate, if they're interested in participating in the study, who should they call?
So I'll start with the second part, if you're interested in participating, if you think, and again, I would invite you, don't even give it too much thought, just give us a call. And we're happy to talk with you, even if it's just to reiterate something we've said today. If you do think you might qualify as a case, give us a call. So my number is the number that you're seeing there. We right now have Andy answering that line, but in general, that's my phone line. It's 603-271-4959, or you can send us an email at ccrtdhhs@dhhs.nh.gov. Just reach out to us. And then there was a first part of that question that if you could just reiterate it, Martha. Oh, preventing exposure. I jotted it down. 1 second. I'm closing my door because my kids are home. Oh, I lost my visual. Preventing exposure, that's another good question to reach out to the Department of Environmental Services to understand what is available in terms of options for water treatment, water testing, that kind of thing. The Department of Health and Human Services does also have the public health lab that does a lot of the water testing for private wells. And so if you do, again, we'll do that sort of no wrong email or phone number. If you do, just reach out to me. I will do my best to connect you with either our public health lab or the Department of Environmental Services.
This is a question from someone who lives across the river from St. Gobain in Manchester and is curious and has a personal cancer cluster in their neighborhood, in their family. And they want to know why Manchester's not included in the investigation. And then someone wanted to know if you could talk more specifically about what's happening in Bedford too.
Okay, so for Manchester, I didn't include it because I was thinking that the towns that were really participating this evening were the 4 that I specifically mentioned. But we did work with the Department of Environmental Services when we redid our analysis, looking at Merrimack. We asked about towns that are known to have some level of PFAS exposure detected in either the public water or in private wells, and Manchester was identified as one community that had that. And so we did include them sorry, I'm just going to let my dogs out so they don't bark. So we did look at that same calculation, the standardized incidence ratio for the 27 different cancer types in Manchester. I can provide additional detail because there were towns beyond the 5 that I've named that were identified that were looked into. Again, for all of those towns, the PFAS associated cancers, the 3 that I listed, were not found to be higher than expected. And so again, for Manchester and for Bedford, it's that same sort of answer of we'll really try and cast as large a net as we think is possible when we do that case definition. And so it really could be that if you live in Manchester and you have kidney cancer, you might meet the case definition. And similar to what I've said previously, for that individual, again, give us a call, send us an email, let us know, because that's helpful information for us.
We had a couple of questions that were related to diabetes. Would the diabetes program be able to look at kidney health, for example, through the numbers of cases that are on dialysis? And then another one to clarify, could they get a general sense of kidney health through the number of cases with diabetes on dialysis, not cancer cases?
So the answer,
2 different questions, or 2 different people asking a similar question.
Oh, okay. Yeah, so again, in terms of what the Department of Health and Human Services can do, that's not something that we have data available to us to be able to look at, but that's, it sounds like the sort of thing that an academic partner might be, interested in doing, may already be doing as part of a study looking at the health impacts of PFAS. The department, it doesn't have a similar law in terms of what we have for the New Hampshire State Cancer Registry. So we just don't have the authority or the resources to be collecting that kind of data beyond cancer data.
I'm going to turn it over to Andy now to ask some of the questions that came in from people viewing this on their local cable network, or local cable channel rather. And I'm going to check to see if there were any more questions thrown in the Q&A, and then we'll come back to those after.
Okay,
Okay, how's my volume?
good.
All right. We had a presenter is giving us no solid information. She mentioned blood tests, but not the results. I've been going to meetings for 6 or 7 years now, and it's always the same. We've lived in Merrimack for 40 years, but are told we don't qualify for free blood tests or to be reimbursed for the bottled water we purchase to drink, cook, and bathe with, as we are not on a well. So is there going to be any change to that policy about being on a well?
Yeah, let me answer a couple of those things. So bottled water would definitely be something to follow up with the Department of Environmental Services on. That's not something that the Department of Health and Human Services is involved in overseeing. So I can't answer the question about if eligibility will be expanded. In terms of the blood testing, yeah, I did say I am not aware of any plans for the department to resume the exposure assessment that had been done starting back in 2016. I do know that data on the results of blood testing that was done is publicly available, and that's on the, if you Google the DHHS data portal, it would probably come up, but I'm also happy to have that person, if we have their contact information, Andy, if you have their phone number,
Yes.
if you give that to me, we can follow up with them and at least connect them with the data from the blood testing that was done.
So another question. Should the presenter's use of the term kidney cancer also be interpreted to mean kidney disease?
No, definitely separate. The only thing that we were able to look at was kidney cancer because that's what we capture in the New Hampshire State Cancer Registry.
Another question. Our water was just tested and we were told our levels are too high. Same with our neighbors. Is the state, and this is probably a repeat, but sorry, is the state / DHHS still conducting free testing?
So I'm not sure if it's free testing of blood, because it sounds like they already had their water tested. And so my answer right now is not that I'm aware of. That's not something the department's doing. If it's testing for water, which I'm guessing they don't need because they said it was already tested. But if anybody is interested in understanding if they might be eligible for that, I would refer them to either the Department of Environmental Services or the Public Health Lab.
Excellent. And that was it.
Okay.
Okay, we had a few other questions that came in. I think that you've answered this, but it's an important question because it's being asked again. Why are we only discussing kidney cancer, even though PFAS may cause many different types of cancer?
If kind of going back to the slide where I talked about that we looked at, we did this calculation, which is really looking for that signal. And that's part of how we decide to go from the phase 2 to phase 3 of our cancer concern protocol. And so we looked at a number of cancers, 27 different ones, including the 3 types that have been shown to be associated with PFOA. And it was only kidney cancer in Merrimack that actually was found to be at a higher than expected number than, the rest of New Hampshire. So that's really what has been guiding our next steps in the cancer concern review protocol.
And then regarding data, where do you get the data regarding all the different cancers you mentioned? Will you be able to update the data when, will this data be updated
Yeah, so we get all the data that we use for this investigation to look at the number of new cases and compare them to the rest of New Hampshire. All of that data is from the New Hampshire State Cancer Registry. Dartmouth is our contractor. They administer the cancer registry, and they capture data from what are called mandated reporters, and that includes the large hospitals in New Hampshire that diagnose a large number of the new cancers in the state, but it also includes other providers like dermatologists or urologists that may only diagnose a few cancers per year, but they go ahead and report the data to the state cancer registry. And then the second part of the question about updated data, that is something that we capture, at an ongoing basis, and we would be able to revisit the analysis again that we've done now in 2021, potentially in another couple of years to look at other cancer types as well.
Someone else was wondering if it would be possible to have the state epidemiologist, John Patelli, present to the group.
So the state epidemiologist is Dr. Chan. He works for the Department of Health and Human Services. People may have seen him on WMUR talking about COVID. I know I've seen him. Dr. John Patelli is the toxicologist for the Department of Environmental Services, and I think he is available. I included his contact information on the slide where I had my contact information as well as a number of other people, and I did identify him as a resource for people to ask questions about the health impacts of PFAS. So I would reach out to him and ask questions that you have. And I'm not familiar, with any planned community meetings where he will be presenting, but I do know he presented at a community meeting. I want to say it was back this summer, and that's recorded. So if you reach out to him, I bet he can share the link for that meeting recording, and there's probably a lot of good information there.
So this question is, are there plans to look at other PFAS-related problems that aren't cancer, like hormonal dysfunction, immune system dysfunction, learning disabilities in babies born to moms who drank PFAS water, just to name a few?
So in terms of the department plans, that's not something that we plan to look into further. A lot of that's related to the limitations in terms of what we have access to for data. So we're pretty much limited to cancer data in terms of what we can do. That said, I think it is a topic of interest for researchers, and that there's likely work being done by, different academic organizations to understand some of those different health outcomes related to PFAS and PFAS exposure. And again, that might be something that would be worth asking Dr. Patelli, because I think he's probably the most up to date on what's been going on in terms of research.
And the last question that we have, does New Hampshire require reporting of a cancer diagnosis? Is it optional? So I think it's just reinforcing your answer before.
Yep, so it is required by state law, and we do have certain, as I said, the large hospitals in the state that diagnose over 100 cases of cancer in a year are required to have one of those individuals on staff called a certified tumor registrar. And then our contract with Dartmouth helps to facilitate reporting from smaller entities who diagnose fewer than 100 cancer cases per year. So that's the dermatologists, urologists, some of those other individuals who don't have a certified tumor registrar on staff.
And we did have another question come in for people who are fighting cancer. How can this information be helpful?
I'm not sure that much of the information in terms of understanding the rates or the difference in kidney cancer in Merrimack compared to the rest of the state is going to inform an individual who's in treatment. I do think, our number and our email is available if people want to reach out to us and they have questions. So maybe this community meeting helps people be aware of that the department has a cancer program. And we really do work on a lot of things and not just response to community concerns. So like I said before, we operate a free screening program. We're really focused on addressing cancer survivors' needs in the state. And so I would invite people to reach out. So maybe at the very least, just knowing that the department has this resource, and we actually have a number of staff working on cancer beyond environmental response.
That's it for questions. And unless Andy had any callers during that last session?
No new ones.
No new ones. Okay. So this concludes the public meeting. And if you think of something else or have a lingering question, we want to remind you that you can call the number, the 603-271-4959. And you can also go to the Comprehensive Cancer Program's website and download the material that was mentioned, the reports, and you'll find a link that you can send an email. For those of you who registered tonight, we are sending out an email to you tomorrow with some of that information to remind you. And then I want to remind you, you can watch this recording. In about a week, we'll have it posted on the New Hampshire Public Health YouTube channel. So thank you everyone for attending.
Thank you. Have a good evening.